So Coach Stormy is on her road to correcting her butt shots. She put out a part 1 video, which I did a commentary on. Now she has put out a part 2 video, which I'm going to do a commentary on. That is this video. And her road to recovery is eye-opening for those of you who are thinking of getting BBLs, or back in the day, butt shots. I can't even say back in the day because a lot of people are still doing it. They used to call it basement surgery. You go to a hotel and you lay on the bed and somebody come and inject you and you get all this scarring. That's why a lot of folks you see with this hardened butt, because there's a lot of scarring and the butt tissue is hardened. And with her, she says during the surgery, the doctor had to stop the surgery because when he looked at the color of the nodules, they were not the right color. In other words, what he was expecting to see, it was a different color. It kind of looked, this is what I'm figuring out, because he didn't say it. But when I saw what he was looking at to make him stop, it looks like lymph nodes that was all in mesh with the substance that was injected along with her normal tissue, and the lymph nodes was all in there and everything was intermesh. He couldn't separate it. But what he saw, he thought maybe that would have been the injectable substance with tissue, of course. But what he saw was the injectable substance, tissue, plus the lymph nodes all mangled up and tangled up and enmeshed. He could not separate the lymph nodes. So, of course, he could not remove the lymph nodes without removing a lot of healthy tissue. And he could not remove the foreign substance without removing part of the lymph nodes. And so he didn't want to touch the lymph nodes for good reason. And so he had to stop the surgery. This is what I'm gathering from what she said. So according to Google, the lymph is oval, and usually the color is white or pale white. But if the lymph is found in capillaries, the color is generally yellow. But here we see in the picture that the lymph that the doctor is looking at is white. It appears to be white. It was her lymph nodes. And had he removed it, she would have had problems with lymphedema, because you guys know the lymph nodes helps with the filtering of the body. And if you don't have the lymph nodes to help filter fluids in your body, then you're going to have a lot of edema, a lot of swelling. We see a lot of people with severe swelling, big feet, big thigh, big legs, because they have a problem with their lymph nodes filtering properly. So according to Google, lymphedema occurs when the lymph vessels are not able to adequately drain lymph fluid, usually from the arm or leg. So you're going to have swelling in those areas. So in the above pictures, we see where the lymph nodes are in the body. They're quite diffuse. They're all over the body. According to Google, clusters of lymph nodes are found in the neck, the axilla, which is under the armpit, chest, abdomen, and the groin. For example, there are about 20 to 40 lymph nodes in the axilla, that is under the armpit, also called the lymph gland. So the lymph gland in the body, all these lymph glands that are found all over the body, they're very, very, very important for fighting disease. According to Google, lymph glands filter substances that travel through the lymphatic fluid, and they contain lymphocytes, which are white blood cells. And these white blood cells help to fight the body's infection and disease. Any type of disease that your body have or infection, these lymph nodes will help to fight the infection, will help to fight, because they contains white blood cells, which are the soldiers that go out there and battle for you to help fight disease, to help fight any germs, bacteria, etc. that's entering the body. So the lymph glands are part of the body's immune system. That's why it was a blessing when the doctor did not cut out those little white bean-shaped structures that he saw when he cut into Coach Stormy. He left it intact. He stopped the operation. He said he could not move on because it was all tangled into the lymph nodes. And for him to remove the tissue, the lymph nodes would follow. Had he removed them in his attempt to get rid of the substance in her body, he would have been causing a lot of issues. Well, she would have had a lot of issues today with swelling. So here is Coach Stormy talking about her process in the second video, what she went through on her journey to remove the butt shots. So here's her doctor in Colombia doing a one-on-one consultation with her.
Only two techniques. The close technique, which we remove with the special cannulas, special lasers that I have, and the open technique, which is a cut. With none of those techniques, no one is able to remove it 100%, right? Because the product goes like inside of your own tissue and become kind of part of your own tissue, right? With the close technique, we can remove about 30 to 40%. If the case is to remove. I know your case is different, but I'm just giving you.
I was kind of thinking it's not to focus on removing it that much. It's not the removal, it's the deformity. What if we just left it and just it's deformed. Like in my clothes, it looks you just see the deformity.
So dice ella, está deformado, ¿verdad? Pero
Sí.
dice, y si no le saca
Not they say
tanto,
take it out, but just fix the deform like.
porque dice
like
que tal vez
all
no
of
le
this.
tienen que sacar todo, ¿verdad? Pero quiere que,
Like all of this right
como
here.
todo eso, por ejemplo, quitárselo para
You just like
subirlo,
take this out and lift it.
o va a tener que sacarle todo.
Vamos a ver, vuelvo y te digo, con las imágenes.
So pretty much the doctor explained to her that in order to take it out, there would be a lot of damage caused to her tissue if the tissue is not good, underlying tissue. And so they had to do a lot of testing to see how much her tissues were affected and the lymph nodes, if they were involved extensively with this foreign substance.
20 centímetros de piel.
He's going to have to remove skin to bring it up.
Right. Exactly. I figured that.
But there's still good tissue in there. That's the tissue that will help him form a nice round glute. It just depends on the tissue, what condition it's in.
That is just the nurse as well as the interpreter. She acted as the interpreter because her English is that good to explain to Coach Stormy what the doctor was trying to convey to her.
So basically, what you just witnessed is me having a sit-down consultation with Dr. Lipo. Dr. Lipo was going to be the one who was going to originally do my silicone butt shot removal. But when I went to him, he explained to me how the process would work if I went to him. But he also explained to me that he specializes in BBLs, in 360 lipo, and mommy makeovers, not in bipolymer removal. So he recommended me to have a conversation with Dr. Camacho. And as I sat down with Dr. Camacho, one of the things that I wanted to happen was I did not want to remove all of the butt shots because one of my concerns is I didn't want to have a flat butt. I did not want my butt to be flat. I cared about the appearance of my butt after. And so as you listen to me talk to him, I'm explaining to him, don't remove it all. Just remove enough and make sure that you make it look aesthetically pleasing. But as you listen to him, you're going to also hear, or you probably heard, that he said, depending on my tissue. So I want each and every woman that's going to go and have this procedure to understand that our tissue gets damaged differently according to how the injections was placed and how our body responded to the injections.
And also how healthy you are as an individual. Whether or not you are in the pillar of health makes a difference also.
One of the things that I hoped and I prayed that my tissue was not damaged because if my tissue was damaged, it was going to aesthetically affect the roundness of my butt. So thank God he was able to use my own tissue. I thought I was going to have to do a BBL, which is something that you can't even do at the same time as the silicone removal or the butt injection removal. So I want you ladies to know that if you do get butt shots, which you shouldn't say no to butt shots by polymers, if you're going to do something, do BBLs. But if you do it and you cannot keep the roundness or the look that you want, you may have to come back for a second surgery because a BBL and butt shot removals cannot happen at the same time. So one thing I would tell you all, I'm grateful. Thank God my tissue was not damaged. He was able to manipulate my own tissue and to give me the desired look that I was hoping for. And also I will say this, know that the post-op care is extremely important. There's a lot of you all that are not going to understand, like, why do I have to stay in Colombia for a month? It's because the post-op care, the massages, the tapes, the wound care, it's very important that a professional does it. And I would tell you that one of my experiences here was that this is their project. Like, I am their project. So if I leave them and go home and have somebody else do it, they don't know how this surgery, or can I say revision, was supposed to turn out. It's not their project. And so just know that, keep in mind that you may have to stay here for 30 days.
You guys heard that? For those of you who are thinking of any type of butt surgery, and these doctors release you the same day to go back to the hotel for maybe a week recovery while the nurse tapes you up and change your dressing, trust and believe the process should be longer. You shouldn't just stay for a week or two and then go home. According to Coach Stormy, if you want a speedy recovery and a recovery that is not complicated in any type of way, any setbacks, infections, etc., you should stay for at least a month for proper care before returning back to home. But I guess she can say that without blinking an eye because she's got the money to pay a private nurse for a month. A lot of people don't have that type of disposable income. So they return home within a couple of days and they have to do their own bandages. They have to monitor their temperature and bleeding, and they have to wrap those wounds and, change the dressings, and they have to be their own nurse, in other words. They don't have that discretionary fund like Coach Stormy. She's got long Benjamins, okay? She's got a whole heap of money. So it's easy for her to say, lay up there and have a private nurse take care of all your wounds and your bandages and change your dressings, etc. But not a lot of people have it like that. So in other words, if you don't have it like that, think twice before having the surgery because you may run into complications and you're going to have to be your own nurse if you don't have that money for a private nurse. Here, we have heard so many cases in the U.S. where these women stay about a week, a couple of days, they get on a plane. For the life of me, I don't know how someone can get on a plane after having butt surgery. How are they going to sit on the plane? That's my question. You're not going to lie down. They're not going to provide you a little bed for you to lay on your stomach. No, you're going to have to sit up on that plane. So all these women who go to the DR and Colombia and Mexico and Miami to get these BBLs, and then they're on a plane the next day flying home. Trust me, it is not the wisest thing for them to do.
Keep in mind, y'all, that again, your shape depends on your tissue and it depends on your post-op care.
So guys, that's part 2 of Coach Stormy's journey to remove the illegal injection she had when she was a teenager. And if it can help any of you out there to not do it, then this awareness video would have done its job. But any surgery is not safe because it's an invasion of your body. It's very invasive. So always bear in mind, if you're going to cut into your body for any reason, you are opening your body to infection from the outside world. There's bacteria all around you. There's bacteria living on your skin. The minute you open up a wound, like cutting into your flesh, you are exposing yourself to getting an infection. And especially something like the BBL or butt injections, inject a foreign object into your body. That is so dangerous. So think twice about it. For those of you who want to stick around for a while and stick around and be healthy. YouTubers, drop your comments. I'm over and out. Don't forget to like, share, and subscribe to my channel and my videos. Thank you for watching.